Now this is a story all about how my life got turned upside down. And I'd like to take a minute, just sit right there. I'll tell you how I came to work at Regis Care. In West Philadelphia, born and raised, in the dugout was where I spent most of my days, just chilling out, maxing, relaxing, all cool, just treating the athletes outside of the school. When a couple of chicks drinking soda refills started asking me questions about my rad skills, and made me an offer that I couldn't refuse and said you should move to a place where your talent could be used. They said it's a job with incredible pay, so I packed my suitcase and I went on my way. After high fives, they gave me a ticket, put my Discman on, said might as well kick it. Skated up to the place about 7 or 8 and yelled to my lady, well chick, smell you later. Looked at my kingdom, I was finally there, to sit on my throne as a prince of Regis Care.
Hi, I'm Jesse. I'm going to be your physical therapist today. Me and my assistant, Emily, are going to do some muscle length testing and flexibility with you. I'm Jesse.
I'm Jackie. I'm Laura's mom. Is it okay if I take the session?
Absolutely. Okay, so now that we've done a preliminary screen, we're going to start by doing an iliopsoas test. So first, I'm going to, due to the possible limitations of the patient not being able to hold her position by herself, we're going to do a modified two-person test. So I'm going to bend her knee to 90 degrees and hold that there while I'm providing stabilization on the ipsilateral side. And I'm going to maximally extend her hip while my assistant takes a measurement.
Okay, to take the measurement, my axis of rotation is going to be at the greater trochanter. The stationary arm is going to be midline with her trunk. And the moving arm is going to be at the lateral condyle of her knee. Ready?
Perfect. So now, just to demonstrate an alternative method, we're going to reposition the patient into a supine position. For the second iliopsoas test, we're going to do what's called the Thomas test. So with the patient laying supine, I'm going to place my hands underneath her lower back. I'm going to lift her opposite leg here up to her chest until her lower back flattens to the table and I can feel it pressing against my hand. Now my assistant's going to take a measurement.
Okay, the landmarks are the same as before. My axis is going to be at the greater trochanter. The stationary arm is going to be in midline with her trunk, and the moving arm is going to be to the lateral of the condyle.
So while we're in the supine position, we're going to go ahead and do a gastrocnemius test. So first of all, I'm going to bend the contralateral knee just for comfort, and then I'm going to stabilize underneath the knee and dorsiflect her foot until I meet resistance, while my aide takes a measurement.
Okay, for this measurement, my axis is going to be at the lateral malleolus. My stationary arm is going to be towards the head of the fibula. And my moving arm is going to be in line with the fifth metatarsus. Okay.
Okay, so our results show that you have tight hip flexors and gastroc muscles, which is pretty typical in patients who have spastic CP. So in order to increase the flexibility, we've implemented a home exercise program to help you guys follow the process.
Can you tell us why you chose these particular tests for Laura?
Sure, we chose to do the Thomas test because a recent study by Glansman showed that it is a really reliable test and it's actually very comparable to other tests.
So why is flexibility important for me?
Well, if your muscles are too tight, then your joints can't move as far as they would need to, and that's what makes you have a hard time walking. So for example, when someone with CP, they usually have a hip contracture, so their hip is slightly flexed, their knee is slightly flexed, and they have contractures that also plantar flex the foot. So you can see, if you can't straighten your leg out all the way, it'd be really difficult to walk properly.